Section 2. Practice questions and rationales. 1. While acquiring information about the current medication use of the client tells the nurse that they take the herbal supplement ginkgo to improve mental alertness. The nurse should inform the client to A. Avoid any exposure to the sun whilst using ginkgo. B. Buy only brands with FDA approval. C. Increase daily intake of vitamin E. D. Report signs of bleeding or bruising to the doctor. Answer D is correct. Ginkgo interacts with many different medications to increase the risk of bleeding. Because of this, bruising or bleeding should be reported to the doctor. Answer A is incorrect because photosensitivity is not a side effect of ginkgo. The FDA does not regulate herbals and natural products, and therefore answer B is also incorrect. Lastly, the client does not need to take additional vitamin E, therefore answer C is also incorrect. 2. The client has a prescription for a calcium carbonate compound in order to neutralize stomach acid. The nurse should assess the client for A. Diarrhea, B. Constipation, C. Hyperphosphatemia, D. Hypomagnesemia. Answer B is correct. A client using calcium preparations will frequently develop constipation. Answers B, C, and D do not apply in this scenario. 3. Which of the following medications are Category X medications and therefore should not be taken by the client during pregnancy? A. Sulfasalin, B. Devonex, C. Levothyroxine, D. Minocycline, E. Tazorac. Answers B, D, and E are correct. Devonex, minocycline, and Tazorac are all medications under Category X and should therefore not be given during pregnancy because they are teratogenic. 4. Your client is taking alendronate sodium, Fosamax. Which instruction should you give to your client? A. Remain in an upright position for 30 minutes after taking this medication. B. Take the medication while lying down. C. Force fluids while taking this medication. D. Take the medication together with estrogen. Answer A is correct. This drug causes gastric reflux, so the client should remain upright and take it with only water. Alendronate sodium is a drug used in the treatment of osteoporosis. Alendronate sodium should not be taken while lying down and should not be taken in conjunction with another medication or with estrogen. Notice, there is a clue in the name of the drug, fossa as in fossils. All the drugs in this category contain the syllable dronate. 5. A client is discharged with a prescription for Evista, raloxifene HCl. The nurse should inform the client that which of the following is a side effect of this drug? A. Urinary frequency, B. Leg cramps, C. Hot flashes, D. Cold extremities. Answer C is correct. Evista is a drug used in the treatment of osteoporosis. The medication has an agonist effect, which binds with estrogen and which can cause hot flashes. The medication does not cause any of the other symptoms, and answers A, B, and D are therefore incorrect. Notice, the E in Evista stands for estrogen. This medication is in the same category as the chemotherapeutic agent tamoxifen, Nolvadex, which is used for breast cancer. 6. The client, an elderly diabetic, is scheduled for a cardiac catheterization. The client has been taking metformin, glucophage. The nurse should instruct the client to A. Take the medication with only water prior to the exam. B. Take the medication as usual prior to the exam. C. Limit protein intake prior to the exam. D. Discontinue the medication prior to the exam. Answer D is correct. This is because glucophage can cause renal problems. The dye used in cardiac catheterizations is likewise detrimental to the kidneys. After the cardiac catheterizations, or until renal function returns, the client may be placed on sliding scale insulin for 48 hours. Note that B and D are opposites. B is incorrect because the client should stop taking the medication prior to the exam. Answer A is incorrect because taking glucophage with water is not necessary. And answer C is likewise incorrect because limiting protein intake prior to the exam has no correlation to the medication. Notice, the syllable phage means eating. 7. The client is taking furosemide, Lasix. Which of the following laboratory results should be of concern to the nurse? A. Sodium level of 140. B. Potassium level of 2.5. C. Glucose level of 110. D. Calcium level of 8. Answer B is correct. This is because furosemide, Lasix, is a loop diuretic. Notice, most loop diuretics end in the syllable "ide." 8. A client who has just undergone an exploratory laparotomy is admitted to the recovery room. Which of the following medications should be kept nearby? A. Diphenhydramine, Benadryl. B. Flumazenil, Romazicon. C. Naloxone hydrochloride, Narcan. D. Nitroprusside, Nipride. Answer C is correct. Answer C is correct because Narcan is the antidote to narcotics. During the postoperative period, narcotics are given to the client. Answer A is incorrect because Benadryl is an antihistamine. Answer B is incorrect because Romazicon is the antidote for the benzodiazepines. Answer D is incorrect because Nipride is used to lower blood pressure. 9. The client with renal failure has a subscription for erythropoietin, Epigen, which is to be given subcutaneously. The nurse should instruct the client to report which of the following symptoms: A. Decreased urination. B. Itching. C. Severe headache. D. Slight nausea. Answer C is correct. This is because severe headache can indicate impending seizure activity. It should therefore be immediately reported. Answers A and B are incorrect because a client with renal failure already suffers from itching and decreased urination. Answer D is incorrect because slight nausea is expected when beginning the therapy. 10. A 4-year-old client with cystic fibrosis has an order for Viocase pancreatic enzymes to prevent malabsorption. The pancreatic enzyme should be administered A. On an empty stomach. B. 1 hour before meals. C. 2 hours after meals. D. With each meal and snack. Answer D is correct. Viocase is a pancreatic enzyme used to facilitate digestion. The enzyme should therefore be given with meals and snacks. Viocase works well in foods such as applesauce. Answers A, B, and C are all incorrect. 11. A 20-year-old client has an order for tetracycline. While teaching the client how to take the medicine, The nurse is told that the client is currently also using orthonovum, an oral contraceptive pill. The nurse should inform the client that A. Antibiotics can decrease the effectiveness of oral contraceptives. Because of this, the client should use different types of birth control. B. Nausea often results from taking oral contraceptives and antibiotics. C. The oral contraceptives will decrease the effectiveness of the tetracycline. D. Toxicity can result when taking these two medications together. Answer A is correct. Taking both antibiotics and oral contraceptives at the same time decreases the effectiveness of the oral contraceptives. The client should therefore be advised to take a different type of birth control. 12. The nurse is visiting a home health client with osteoporosis who has a new prescription for alendronate, Fosamax. Which instruction should be included in the teaching plan? A. Avoid rapid movements after taking Fosamax. B. Don't take any other medications for 30 minutes after taking the Fosamax. C. Rest in bed for at least half an hour after taking the medication. D. Take the medication with water only and remain upright for at least 30 minutes after taking the medication. Answer D is correct. Fosamax should be taken with water only. The client should also remain upright for at least 30 minutes after taking the medication. Answer C is the opposite of answer D and is therefore incorrect. Answers A and B are not applicable to taking Fosamax and are therefore also incorrect. 13. The client diagnosed with multiple myeloma has a subscription for cyclophosphamide, Cytoxan. The nurse should instruct the client to A. Drink at least 8 large glasses of water a day. B. Immediately report nausea to the doctor. C. Increase the fiber intake in your diet. D. Walk for at least 30 minutes a day to prevent calcium loss. Answer A is correct. The medication can cause hemorrhagic cystitis, and because of this, the client should drink at least 8 glasses of water a day. Answer B is incorrect, as nausea often occurs with chemotherapy. Answers C and D are both not necessary and are therefore incorrect. 14. The nurse is guiding a mother through the treatment for enterobiasis. Which instruction should be included in the teaching plan? A. Intravenous antibiotic therapy will be ordered. B. Medication therapy will continue for 1 year. C. The entire family should be treated. D. Treatment is not recommended for children under the age of 10 years. Answer C is correct. Pinworms, enterobiasis, is treated using Vermox, mebendazole, or Antiminth, parental pamoate. To make sure no worms remain, it is important that the entire family is treated. The family should get tested again after 2 weeks. Answers A, B, and D do not apply and are therefore incorrect. 15. Lidocaine is a medication frequently prescribed for the client experiencing A. Atrial tachycardia. B. Heart block. C. Ventricular brachycardia. D. Ventricular tachycardia. Answer D is correct. Lidocaine increases the electric stimulation threshold of the ventricles without depressing the force of ventricular contractions, thereby exerting an antiarrhythmic effect. The medication is therefore used in the treatment of ventricular tachycardia. Answer A is incorrect because lidocaine is not used for atrial arrhythmias. Answers B and C are incorrect because lidocaine slows down the heart rate and is therefore not used for brachycardia or heart block. 16. The client is scheduled for a tensilon test to check for myasthenia gravis. Which of the following drugs should be kept available during the test? A. Atropine sulfate. B. Promethazine. C. Prostigmin. D. Furosemide. Answer A is correct. This is because atropine sulfate is the antidote for tensilon and is therefore used to treat cholinergic crises. Answers B, C, and D are all incorrect. Answer B is incorrect because promethazine is an antiemetic anti-anxiety medication. Answer C is incorrect because prostigmin is utilized to treat myasthenia gravis. Answer D is incorrect as furosemide is a diuretic. 17. Which of the following should be used in the treatment of iron toxicity? A. Desferal, deferoxamine. B. Digibind, digoxin immune fab. C. Narcan, naloxone. D. Zinacard, dexrazoxane. Answer A is correct. Desferal is used to treat iron toxicity. Answer B is incorrect because Digibind is used to treat dioxin toxicity. Answer C is incorrect because Narcan is used to treat narcotic overdose. Answer D is incorrect because it is utilized to treat doxorubicin toxicity. Answers B, C, and D are all antidotes for other medications. 18. The physician has prescribed amoxicillin, 500 mg capsules for a client with esophageal varices. The nurse can best care for the client by A. Administering the medication with an antacid. B. Giving the client the medication as ordered. C. Providing extra water with the medication. D. Requesting the medication in an alternative form. Answer D is correct. The client with esophageal varices could potentially develop spontaneous bleeding from the mechanical irritation caused by taking capsules. Because of this, the nurse should request an alternate form of the medication, for example, a suspension. Answer A is incorrect because amoxil should not be given with milk or antacids. Answer B is incorrect because this would not be in the best interest of the client. Answer C is incorrect because providing extra water is not a good means of preventing bleeding. 19. The physician has prescribed Dilantin, phenytoin, 100 mg for a client with generalized tonic-clonic seizures to be administered intravenously. The nurse should administer the medication A. Rapidly with an IV push. B. Through a small vein. C. With IV dextrose. D. Slowly over 2 to 3 minutes. Answer D is correct. Dilantin should be administered slowly, no more than 50 mg per minute, as cardiac arrhythmias can otherwise occur. Answer A is incorrect because the drug must be administered slowly. Answers B and C are also incorrect. Dextrose solutions cause the medicine to crystallize in the line, and the medication should therefore be administered through a large vein in order to prevent purple glove syndrome. 20. The nurse finds that the respiratory rate of a post-operative client has dropped from 14 breaths per minute to 6 breaths per minute. The nurse gives the client Narcan, naloxone, as per standing order. After Narcan has been administered, the nurse should assess the client for A. Projectile vomiting. B. Pupillary changes. C. Sudden intense pain. D. Wheezing respirations. Answer C is correct. The medication Narcan is a narcotic antagonist that blocks the effects of the client's pain medication. Because of this, the client will experience sudden intense pain. Answers A, B, and D are incorrect because they do not relate to the condition of the client in relation to the administration of Narcan. 21. A client with congestive heart failure has been maintained with digoxin, lanoxin. Which of the following indicates that the drug is having a desired effect? A. Improved appetite. B. Increased pedal edema. C. Increased urinary output. D. Stabilized weight. Answer C is correct. The medication slows and strengthens the contraction of the heart. An increase in urinary output therefore shows that lanoxin is having a desired effect by eliminating excess fluid from the body. Answers A, B, and D are all incorrect. Answer A is incorrect because it is not related to the medication. Answer B is incorrect because pedal edema would decrease and not increase. Answer D is incorrect because the client's weight would decrease. 22. The physician has prescribed the medication basal gel, aluminum carbonate gel, for a client with recurrent indigestion. The nurse should inform the client of the side effects that come from using the medication, which include A. Confusion. B. Constipation. C. Diarrhea. D. Urinary retention. Answer B is correct. Constipation is a common side effect of basal gel, which is an antacid that contains aluminum. Answers A, C, and D are all incorrect, as they are not common side effects of the medication. 23. A client in labor has an order for Demerol, meperidine, 75 milligrams IM, which is to be administered 10 minutes before delivery. The nurse should A. Administer the medication as ordered. B. Administer the medication IM during the delivery to prevent pain from the episiotomy. C. Question the order. D. Wait until the client is placed on the delivery table, then give the medication. Answer C is correct. Giving a narcotic to a pregnant client close to the time of delivery can result in respiratory depression in the newborn. Because of this, the nurse should question the order. Answers A, B, and D are all incorrect for the very same reason. 24. The physician has ordered Synthroid, levothyroxine, for a client with myxedema. Which statement shows that the client understands the nurse's instruction regarding the medication? A. I will check my heart rate before taking the medication. B. I will take the medication every morning after breakfast. C. If I develop gastric upset, I will stop taking the medication. D. If I experience any visual disturbance, I will report this to my doctor. Answer A is correct. The client should be instructed and taught to check their heart rate before taking the medication. This is because Synthroid, levothyroxine, increases metabolic rate and cardiac output, and adverse reactions to the medication include tachycardia and dysrhythmias. Answer B is incorrect because the client does not need to take the medication after breakfast. Answer C is incorrect, as the medication should not be stopped if the client develops gastric upset. Answer D is also incorrect, because it has no relation to the medication. 25. A client who has recently been diagnosed with diabetes has started receiving Precose, a carbose. The nurse should instruct the client to take the medication A. 1 hour before meals, B. 30 minutes after meals, C. every day at bedtime, D. with the first bite of a meal. Answer D is correct. The medication should be taken with the first bite of a meal. Answers A, B, and C are all incorrect. 26. A 6-year-old client is being treated for an acute attack of asthma using racemic epinephrine, epinephrine hydrochloride, nebulizer stat. Which of the following indicates an adverse effect of this medication? A. Excitability, B. Heart rate 150, C. Nausea, D. Tremors. Answer B is correct. This is because hypertension and tachycardia are both adverse effects of epinephrine. Answers A, C, and D are all incorrect in this case, as those are expected side effects of racemic epinephrine. 27. The client is being treated with intravenous vancomycin for MRSA. The nurse notices redness of the neck and chest of the client. Place in ordered sequence the actions that the nurse should take. A. Administer Benadryl as ordered. B. Call the doctor. C. Stop the IV infusion of vancomycin. D. Take the vital signs. The correct order is C, D, B, A. 28. A client with leukemia has been receiving oral prednisolone, prednisone. Which of the following is an expected side effect of the prolonged use of prednisolone? A. Decreased appetite, B. Hirsutism, C. Integumentary bronzing, D. Weight loss. Answer B is correct. Hirsutism, or facial hair, is a side effect of cortisone therapy. Answers A, C, and D are all incorrect. These are symptoms of Addison's disease. 29. The physician has prescribed DDAVP, desmopressin acetate, for a client with diabetes insipidus. Which of the following is an indication that the medication is having a desired effect? A. A decline in the client's urinary output. B. An increase in the client's activity level. C. The client has an improved appetite. D. The client's morning blood sugar was 120 milligrams per deciliter. Answer A is correct. A decline in urinary output shows that the drug is having its desired effects. This is because excessive production of dilute urine is a characteristic of diabetes insipidus. Answers B and C are incorrect as they are not related to the question. Answer D is incorrect as it refers to diabetes mellitus. 30. A 15-year-old client with cystic acne has an order for Accutane, isotretinoin. Prior to starting the medication, which lab work is needed? A. Clean catch urinalysis, B. Liver profile, C. Complete blood count, D. Thyroid function test. Answer B is correct. The medication Accutane consists of concentrated vitamin A, which is a fat-soluble vitamin. A liver panel is needed as fat-soluble vitamins can potentially become hepatotoxic. Answers A, C, and D are incorrect as they do not relate to therapy with Accutane. 31. A post-operative client has a prescription for Demerol, meperidine, 75 milligrams, and Phenergan, promethazine, 25 milligrams IM, every 3 to 4 hours as required to counter pain. When taken in combination, the two medications produce A. An excitatory effect, B. A synergistic effect, C. An agonist effect, D. An antagonist effect. Answer B is correct. The two medications, when taken in combination, produce a synergistic effect, that is, an effect that is greater than that of either drug used alone. Answer A is incorrect because the two drugs combined would have a depressing effect and not an excitatory effect. Answer C is incorrect because agonist effects are similar to those produced by chemicals normally present in the body. Answer D is incorrect because antagonist effects are those in which the actions of the medications oppose one another. 32. Prior to giving a client's morning dose of Lanoxin, digoxin, the nurse checks the apical pulse rate. She finds a rate of 54. The appropriate nursing intervention in this instance is to A. Administer the medication and monitor the heart rate. B. Record the pulse rate and administer the medication. C. Withhold the medication and notify the doctor. D. Withhold the medication until the heart rate increases. Answer C is correct. The appropriate nursing intervention in this scenario is to best provide for the client's safety by withholding the medication and notify the doctor. Answers A, B, and D are incorrect. 33. A client with schizophrenia has started receiving Zyprexa, olanzapine. 3 weeks later, the client develops severe muscle rigidity and elevated temperature. The nurse should give priority to which of the following interventions? A. Administering prescribed anti-Parkinsonian medication. B. Ordering a CBC and CPK. C. Transferring the client to a medical unit. D. Withholding all morning medication. Answer A is correct. Severe muscle rigidity and elevated temperature are symptoms that suggest that the client is experiencing an adverse reaction to the medication known as neuroleptic malignant syndrome. Answers B, C, and D are incorrect, as they are not appropriate interventions. 34. A child with cystic fibrosis is receiving inhalation therapy with pulmozyme, Dornase alpha. Which of the following is a side effect of the medication? A. Brittle nails. B. Hair loss. C. Sore throat. D. Weight gain. Answer C is correct. Side effects of pulmozyme include hoarseness, laryngitis, sore throat. Answers A, B, and D are incorrect because they are not associated with pulmozyme. 35. A client who has been maintained with Dilantin, phenytoin, for tonic-clonic seizures is preparing for discharge. Which of the following should be included in the client's discharge care plan? A. A high-carbohydrate diet must be avoided. B. Regularly scheduled blood work will be needed. C. The medication can cause dental staining. D. The medication can cause problems with drowsiness. Answer B is correct. The client will need regularly scheduled blood work because agranulocytosis and aplastic anemia are potential adverse side effects of Dilantin. Answer A is incorrect because the drug does not interfere with the metabolism of carbohydrates. Answer C is incorrect because Dilantin does not cause dental staining. Answer D is incorrect because Dilantin does not cause any problems related to drowsiness. 36. The doctor has prescribed cortisone for a client with systemic lupus erythematosus. Which instruction should be given to the client? A. Report changes in appetite and weight to the doctor. B. Schedule a time to take the influenza vaccine every year. C. Take the medication 30 minutes before meals. D. Wear sunglasses to prevent cataracts. Answer B is correct. This is because a client who is receiving steroid medication should also receive an annual influenza vaccine. Answer A is incorrect because weight gain and an increased appetite are both expected side effects of steroid medication. Answer C is incorrect because the medication should be taken with meals. Answer D is incorrect because wearing sunglasses does not prevent cataracts in the client taking Cortone. 37. The physician has prescribed Stadol, butorphanol, for a post-operative client. The nurse knows that the medication is having the desired effect if the client A. has an increased urinary output, B. is asleep for 30 minutes after the injection, C. reports that he or she is feeling less nauseated, D. states that he or she is still feeling hungry. Answer B is correct. The medication reduces the perception of pain, which allows the post-operative client to rest. Answers A and D are incorrect, as these are not affected by the medication. Answer C is incorrect because, although pain relief can reduce symptoms of nausea, it is not a desired effect of the Stadol. 38. A client is hospitalized with hepatitis A. Which of the client's regular medications is contraindicated due to the current illness? A. Lipitor, atorvastatin. B. Premarin, conjugated estrogens. C. Prilosec, omeprazole. D. Synthroid, levothyroxine. Answer A is correct. Lipid-lowering agents are contraindicated in the client with active liver disease. Answers B, C, and D are incorrect as they are not contraindicated in the client with active liver disease. 39. A client with diabetes mellitus has a prescription for Glucotrol XL, glipizide. The client should be instructed to take the medication A. with breakfast, B. before lunch, C. after dinner, D. at bedtime. Answer A is correct. Glucotrol XL is to be taken once a day with breakfast. Answers B and C are incorrect because the client would have hypoglycemia later in the day or evening. Answer D is incorrect because the client would also develop hypoglycemia while sleeping. 40. The physician has prescribed vancomycin, 500 milligrams IV every 6 hours for a client with MRSA. The medication should be administered in the following manner. A. IV push. B. Over 15 minutes. C. Over 30 minutes. D. Over 60 minutes. Answer D is correct. The medication should be given very slowly so as to prevent red man syndrome. Answer A is incorrect because vancomycin is not given IV push. Answers B and C are also incorrect because the medication should be administered at a slower rate. 41. The nurse calculates the amount of an antibiotic for injection to be administered to an infant. The amount of medication to be given is 1.25 milliliters. Which of the following is the correct way to administer the antibiotic? A. Administer the medication in one injection in the dorsogluteal muscle. B. Administer the medication in one injection in the ventrogluteal muscle. C. Divide the amount in 2 injections and administer one in the ventrogluteal muscle and one in the vastus lateralis muscle. D. Divide the amount into 2 injections and administer in each vastus lateralis muscle. Answer D is correct. This is because no more than 1 milliliter should be administered in the vastus lateralis of an infant. Answers A, B, and C are all incorrect because the other 2 muscles, the dorsogluteal and ventrogluteal muscles, are not used for injections in the infant. 42. A 65-year-old client with glaucoma is scheduled for a cholecystectomy. Which of the following drug prescriptions should the nurse question? A. Atropine, atropine. B. Demerol, meperidine. C. Phenergan, promethazine. D. Tagamet, cimetidine. Answer A is correct. This is because atropine increases intraocular pressure and is contraindicated in the client with glaucoma. Answers B, C, and D are incorrect, as they are not contraindicated in the client with glaucoma. 43. The physician has prescribed Dilantin, phenytoin, for a client with generalized seizures. When planning the client's care, the nurse should A. Check the client's pulse prior to administering the medication. B. Give the medication 30 minutes before meals. C. Maintain strict intake and output. D. Provide oral hygiene and gum care at every shift. Answer D is correct. The nurse should provide oral hygiene and gum care at every shift because gingival hyperplasia is a side effect of Dilantin. Answers A, B, and C are incorrect because they do not apply to the medication. 44. The physician has ordered Cognex, Tacrin, for a client with dementia. The nurse should monitor the client for potential adverse reactions, which include A. Hypoglycemia. B. Jaundice. C. Tinnitus. D. Urinary retention. Answer B is correct. The nurse should monitor the client for any symptoms of jaundice. This is because drug-induced hepatitis is an adverse reaction associated to Cognex. Answers A, C, and D are incorrect because those are not among the adverse reactions that can be linked to the medication. 45. A client exhibiting serum cholesterol of 275 milligrams per deciliter is placed on rosuvastatin, Crestor. Which instruction should a nurse give to a client using rosuvastatin, Crestor? A. Allow 6 months for the drug to take effect. B. Report any signs of insomnia. C. Report any signs of muscle weakness to the doctor. D. Take the medication with fruit juice. Answer C is correct. Crestor is an anti-lipidemic drug. A client using Crestor must therefore report any signs of muscle weakness, as these may be symptomatic of rhabdomyolysis. Answer A is incorrect because the drug takes effect in the first month of starting therapy. Answer B is incorrect because it is unrelated to Crestor. Answer D is also incorrect because mixing the medication with fruit juice, particularly grapefruit, can decrease its effectiveness. Crestor should always be taken with water. 46. The physician prescribes lisinopril, Zestril, and furosemide, Lasix, to be administered concomitantly to the client with hypertension. The appropriate nursing intervention is to A. Administer both medications. B. Administer the medications separately. C. Contact the pharmacy. D. Question the order. Answer A is correct. Zestril is an ACE inhibitor and Lasix is a diuretic for hypertension. ACE inhibitors are frequently given with diuretics, and the nurse should therefore administer both medications. Answers B, C, and D are all incorrect. There is no need to administer the medications separately, to question the order, or contact the pharmacy. 47. The client with varicella will most likely have a prescription for which category of medication? A. Antibiotics. B. Anticoagulants. C. Antipyretics. D. Antivirals. Answer D is correct. Varicella, chickenpox, is a herpes virus, which is best treated with antiviral medications. Answer A and B are both incorrect, because the client is not treated with antibiotics or anticoagulants. Answer C is also incorrect, because even though the client may have a fever before the chickenpox appear, the temperature will usually go down. 48. A client with urinary tract infection has a prescription for pyridium, phenazopyridine hydrochloride. The nurse should inform that client that the medication may A. Cause changes in taste. B. Cause diarrhea. C. Cause mental confusion. D. Turn her urine orange or red. Answer D is correct. A nurse should teach clients taking pyridium that the medication will change the color of her urine. The medication, if taken in large doses, can also result in sclera and pale or yellowed skin. Answers A, B, and C are incorrect, as diarrhea, mental confusion, or changes in taste are not side effects of the medication. 49. A client who has recently undergone a heart transplant is started on medication to prevent organ rejection. Which of the below drug categories prevent the formation of antibodies against the new organ? A. Analgesics. B. Antibiotics. C. Antivirals. D. Immunosuppressants. Answer D is correct. Immunosuppressants are utilized to prevent the formation of antibodies. Answers A, B, and C are incorrect because analgesics, antibiotics, and antivirals are not used to prevent antibody production. 50. A physician has ordered streptokinase for a client. Before administering the medication, the nurse should check the client for A. A history of alcohol abuse. B. A history of streptococcal infections. C. Allergies to pineapples and bananas. D. Prior therapy with phenytoin. Answer B is correct. This is because clients with a history of streptococcal infections could have antibodies that make streptokinase ineffective. Answers A, B, and D are incorrect. There is no reason to assess the client for a history of alcohol abuse, allergies to pineapples or bananas, and there is also no correlation to the use of phenytoin and streptokinase. 51. The nurse has received a pre-op order to administer Valium, diazepam, 10 milligrams, and Phenergan, promethazine, 25 milligrams. The correct process of administering these medications is to A. Question the order because the two medications cannot be given at the same time. B. Administer the Valium first and wait 5 minutes before injecting the Phenergan. C. Administer the medications separately. D. Administer both medications together in one syringe. Answer C is correct. Valium is an anti-anxiety drug, and Phenergan is an antiemetic. The medications should be administered separately, but can be given to the client at the same time. Answer A is incorrect because the two medications can be given to the same client. Answer B is incorrect as there is no need to wait to inject the second medication. Answer D is incorrect because Valium should not be given in the same syringe with other medications. 52. The physician has ordered Cobex, cyanocobalamin, for a client following a gastric resection. Which finding indicates that the medication is having its intended effect? A. Platelet count of 250,000 cubic millimeters. B. Neutrophil count of 4,500 cubic millimeters. C. HGB of 14.2 grams per deciliter. D. Eosinophil count of 200 cubic millimeters. Answer C is correct. The medication Cobex is an injectable form of vitamin B12, or cyanocobalamin. A lab finding showing an increase in HGB levels shows that the medication is effective. Answers A, B, and D are incorrect, as they are not indicative of the effectiveness of the medication. 53. A client with paranoid schizophrenia has a prescription for thorazine, chlorpromazine, 400 milligrams orally twice daily. Which of the following symptoms should immediately be reported to the physician? A. Lethargy, slurred speech, thirst. B. Fever, sore throat, weakness. C. Fatigue, drowsiness, photosensitivity. D. Dry mouth, constipation, blurred vision. Answer B is correct. Any symptoms of fever, sore throat, and weakness should be reported immediately. A granulocytosis is a potential adverse effect of thorazine, which renders the client vulnerable to overwhelming infection. Answers A, C, and D are expected side effects, and there is therefore no need to notify the physician immediately. 54. The doctor has prescribed an infusion of osmotrol, mannitol, for a client with increased intracranial pressure. Which of the following findings indicates the direct effectiveness of the drug? A. An increased urinary output. B. An increased pupil size. C. An increased pulse rate. D. A decreased diastolic blood pressure. Answer A is correct. Osmotrol, mannitol, is an osmotic diuretic, which inhibits reabsorption of sodium and water. An increased urinary output is therefore a direct indication of the effectiveness of the drug. Answers B, C, and D are incorrect, as they do not relate to the effectiveness of the drug. 55. The client with a urinary tract infection has an order for gantracin, sulfasoxazole, 1 gram in divided doses. The nurse should administer the medication A. With meals or a snack. B. 30 minutes before meals. C. 30 minutes after meals. D. At bedtime. Answer B is correct. To enhance absorption, sulfa drugs, including gantracin, should be administered 30 minutes before meals. Answer A is incorrect because the drug should be administered prior to meals. Answer C is incorrect because the medication should always be given on an empty stomach. Answer D is incorrect, as the medication should be administered in divided doses throughout the course of the day. 56. The mother of a child with chickenpox is inquiring whether there is a medication that can help reduce the course of chickenpox. Which of the following medications can be used to speed up healing of the lesions and thereby shorten the duration of fever and itching? A. Periactin, cyproheptadine. B. Varivax, varicella vaccine. C. VZIG, varicella zoster immune globulin. D. Zovirax, acyclovir. Answer D is correct. Zovirax shortens the course of chickenpox, but the American Academy of Pediatrics does not recommend it for healthy children because of the cost. Answer A is incorrect because periactin is an antihistamine that is used to control itching that results from chickenpox. Answer B is incorrect because Varivax is the vaccine that is used to prevent chickenpox. Answer C is also incorrect, as VZIG is the immune globulin that is given to those who have become exposed to chickenpox. 57. The physician has ordered chloromycetin, chloramphenicol, for a client with bacterial meningitis. The nurse should pay particular attention to the following lab report. A. Complete blood count. B. Serum creatinine. C. Serum sodium. D. Urine-specific gravity. Answer A is correct. The nurse should monitor the client's complete blood count most carefully. This is because aplastic anemia is an adverse side effect of chloramphenicol. Answers B, C, and D are not directly affected by the medication and are therefore incorrect. Nevertheless, these should be noted down by the nurse. 58. A client admitted for treatment of bacterial pneumonia has a prescription for intravenous ampicillin. Which specimen should the nurse obtain before administering the medication? A. Complete blood count. B. Routine urinalysis. C. Serum electrolytes. D. Sputum for culture and sensitivity. Answer D is correct. The nurse should obtain a sputum specimen for culture and sensitivity before administering the antibiotic in order to check whether the organism is sensitive to the prescribed medication. A, B, and C are all incorrect, as a routine urinalysis, complete blood count, and serum electrolytes can be obtained after the therapy has commenced. 59. The client with angina has an order for nitroglycerin sublingual tablets. The nurse should instruct the client to take the medication A. After engaging in light exercise. B. As soon as the client notices signs of chest pain. C. At bedtime to prevent nocturnal angina. D. Every 4 hours to prevent chest pain. Answer B is correct. The client should take the medication as soon as he notices chest pain or discomfort. Answer A is incorrect because the tablets should be taken before engaging in activity. Any strenuous activity should be avoided. Answer C is incorrect because the drugs do not prevent nocturnal angina. Answer D is incorrect because the tablets should be taken when the pain occurs and not according to a regular schedule. 60. The client is maintained on Lugol's solution prior to a thyroidectomy. The nurse should instruct the client to A. Take the solution at bedtime. B. Take the medication with juice. C. Report changes in appetite. D. Avoid sunshine while taking the medication. Answer B is correct. Lugol's solution is a soluble solution of potassium iodine, and because of its bitter taste, it should be given with juice. Answer A is incorrect. Answers C and D are both unnecessary and therefore also incorrect. 61. A client is to receive dilantin, phenytoin, via a nasogastric NG tube. When administering the drug, the nurse should A. Administer the medication, flush with 5 milliliters of water, and clamp the NG tube. B. Flush the NG tube with 2 to 4 milliliters of water before administering the medication. C. Flush the NG tube with 2 to 4 ounces of water before and after giving the medication. D. Flush the NG tube with 5 milliliters of normal saline and give the medication. Answer C is correct. When administering the medication, the nurse should flush the NG tube twice with 2 to 4 ounces of water. That is, before and after giving the medication. Answers A and B are incorrect because insufficient amounts of water are used in both options. Answer D is incorrect because saline should not be used to flush the NG tube. 62. A client with pneumocystis carinii has an order for pentamidine, IV. While receiving the medication, the nurse should carefully monitor the client's A. Blood pressure, B. Heart rate, C. Respirations, D. Temperature. Answer A is correct. This is because hypotension is a severe toxic side effect of pentamidine. Answers B, C, and D are incorrect as they are unrelated. 63. A client in labor has received epidural anesthesia with Marcaine, bupivacaine. Epidural anesthesia produces vasodilation, which results in a decrease in blood pressure. To reverse the hypotension caused by epidural anesthesia, the nurse should have which medication nearby? A. Adrenaline, epinephrine, B. Dobutrex, dobutamine, C. Narcan, naloxone, D. Romazicon, flumazenil. Answer A is correct. The nurse should make sure to have adrenaline available to reverse hypotension. Answer B is incorrect because Dobutrex is an adrenergic, which increases cardiac output. Answer C is incorrect because Narcan is a narcotic antagonist. Answer D is likewise incorrect because Romazicon is a benzodiazepine antagonist. 64. 4 clients are to receive medication. Which client should the nurse prioritize? A. The client with abdominal surgery receiving Phenergan, promethazine, IM every 4 hours PRN for nausea and vomiting. B. The client with an apical pulse of 72 receiving Lanoxin, digoxin, PO daily. C. The client with labored respirations receiving a stat dose of IV Lasix, furosemide. D. The client with pneumonia receiving polycillin, ampicillin, IV PB every 6 hours. Answer C is correct. The client receiving a stat dose of IV Lasix should be first to receive his medication. Answers A, B, and D are incorrect because these are regularly scheduled medications for clients whose conditions are more stable. 65. The physician has ordered an injection of morphine for a client with postoperative pain. Before giving the medication, the nurse should check the client's A. Blood pressure, B. Heart rate, C. Respirations, D. Temperature. Answer C is correct. It is absolutely essential for the nurse to assess the client's respirations. This is because morphine is an opiate and can therefore severely depress the client's respirations. Answers A, B, and D are incorrect. 66. A client with AIDS tells the nurse that she regularly takes echinacea to boost her immune system. The nurse should inform the client that A. Herbals can interfere with the action of antiviral medication. B. Herbals have been shown to decrease the viral load. C. Supplements appear to prevent replication of the virus. D. Supplements have been proven effective in prolonging life. Answer A is correct. The nurse should advise the client to discuss the use of herbals with her doctor, because herbal remedies such as echinacea can interfere with the action of antiviral medications. Answer B is incorrect, as it has not been shown that herbals can reduce the viral load. Answer C is incorrect, because herbals do not prevent replication of the virus. Answer D is incorrect, because it has not been shown that herbals can prolong life. 67. The physician has ordered Activase, alteplase, for a client admitted with a myocardial infarction. Which of the following is a desired effect of Activase? A. An increased tissue oxygenation. B. The destruction of the clot. C. The prevention of congestive heart failure. D. The stabilization of the clot. Answer B is correct. The desired effect of Activase, a thrombolytic agent, is to destroy the clot. Answer A is incorrect, because increased oxygenation is not a direct result of the medication. Answer C is incorrect, because Activase does not prevent congestive heart failure. Answer D is incorrect, because the medication does not stabilize the clot. 68. A client informs the nurse that she takes St. John's wort, Hypericum perforatum, 3 times a day to counter mild depression. The nurse should advise the client that A. It is safe to use the herbal with other antidepressants. B. She should avoid eating aged cheese. C. Skin reactions increase with the use of sunscreen. D. The herbal St. John's wort seldom relieves depression. Answer B is correct. The herbal St. John's wort has properties similar to those of monoamine oxidase inhibitors, MAOI. Therefore, eating foods high in tyramine, such as aged cheese, chocolate, salami, and liver, can result in a hypertensive crisis. Answer A is incorrect, because the herbal should not be used in combination with MAOI antidepressants. Answer C is incorrect, because use of a sunscreen prevents skin reactions to sun exposure. Answer D is likewise incorrect, because St. John's wort can relieve mild to moderate depression. 69. A client with chronic pain is being treated with opioid administration via epidural route. Which medication should be kept nearby and available due to a possible complication of this pain relief procedure? A. Diphenhydramine, Benadryl. B. Ketorolac, Toradol. C. Naloxone, Narcan. D. Promethazine, Phenergan. Answer C is correct. Naloxone should be kept nearby as an antagonist for these medications. This is because respiratory depression can occur from the administration of opioids. Answers A, B, and D are not necessarily incorrect, as they might also be needed, but respiratory depression is the most important and most severe problem that could occur. Benadryl and Phenergan may, however, be used to treat itching and nausea. Toradol, which is classified as an NSAID, could be used for its anti-inflammatory properties. 70. The nurse is checking the medication history of a client who was admitted for surgery in the morning. Which long-term medication in the client's history would be most important to report to the doctor? A. Docusate, Colace. B. Lisinopril, Zestril. C. Oscal D. D. Prednisone. Answer D is correct. The nurse should definitely report usage of prednisone. This is because a sudden withdrawal of steroids could potentially lead to a collapse of the cardiovascular system. Answer A, B, and C are incorrect, as these are not so relevant in the maintenance of the steroids. Colace is a stool softener, Zestril is an ACE inhibitor used as an antihypertensive, and Oscal D is a calcium and vitamin agent. 71. A nurse is working in an endoscopy recovery area. To provide conscious sedation, many of the clients are given midazolam, Versed. Which drug should always be available as an antidote for Versed? A. Diazepam, Valium. B. Florinef, Fludrocortisone. C. Flumazenil, Romazicon. D. Naloxone, Narcan. Answer C is correct. Romazicon, a benzodiazepine, is the antidote for Versed, which is used as an anti-anxiety drug and for conscious sedation. Answers A, B, and D are incorrect, as these medications are not used as antagonists for Versed. 72. A client with asthma has a prescription to start an aminophylline IV infusion. Which of the following is essential for the nurse to safely administer the medication? A. Cover to prevent exposure of solution to light. B. IV infusion device. C. IV inline filter. D. Large bore intravenous catheter. Answer B is correct. An infusion device should be used to regulate aminophylline, thereby preventing improper infusion rates. Answers A, C, and D are incorrect, as they are not necessary for administration of this medication. 73. A client with osteoporosis is being discharged on alendronate, Fosamax. Which statement would indicate a need for further teaching? A. After taking Fosamax, I should remain in an upright position for 30 minutes. B. I should not have any food with this medication. C. I should take Fosamax orally with water. D. I should take the medication immediately every night before bedtime. Answer D is correct. Fosamax should be taken in the morning before taking any other medications and before having food. The medication should be taken with water as the only liquid. Statement D is therefore incorrect and is a sign that further teaching is required. All other answers, A, B, and C, are correct administrations. 74. A client has an order for Demerol 75 milligrams and atropine 0.4 milligrams IM as a preoperative medication. The Demerol vial contains 50 milligrams per milliliter, and atropine is available 0.4 milligrams per milliliter. The nurse should administer how much medication in total? A. 1.0 milliliters. B. 1.7 milliliters. C. 2.5 milliliters. D. 3.0 milliliters. Answer C is correct. The calculated dosage of atropine is 1.0 milliliters, and the calculated dosage of Demerol is 1.5 milliliters, which comes to a total of 2.5 milliliters. Answers A, B, and D are all incorrect calculations. 75. The nurse is discharging a client with asthma with a prescription for Zafirlukast, Accolate. Which statement by the client would indicate a need for further teaching? A. I should take this medication when eating. B. If I'm already having an asthma attack, this drug will not stop it. C. My doctor might order liver tests while I'm on this drug. D. Should I experience any flu-like symptoms, I should report this to my doctor. Answer A is correct. The medication should be taken either 1 hour before or 2 hours after meals. This is to prevent slow absorption of the drug. Statement A is therefore incorrect and is a sign that further teaching is required. Answers B, C, and D are all correct statements. 76. A physician has prescribed haloperidol, Haldol, for a client with advanced Alzheimer's disease. Which of the following symptoms suggests that the client is experiencing side effects from this drug? A. Cough. B. Diarrhea. C. Pitting edema. D. Tremors. Answer D is correct. When taking Haldol, tremors are an extrapyramidal side effect that can occur. Answers A, B, and C are all incorrect and are not side or adverse effects of the medication. 77. A client with Alzheimer's disease has an order for donepezil, Aricept. Which information should the nurse always include in the teaching plan for a client who is placed on Aricept? A. If a dose is skipped, take 2 the next time. B. Rise slowly because the medication can cause dizziness. C. Take the medication with meals. D. The pill can cause your heart rate to increase. Answer B is correct. Dizziness is a side effect of Aricept, and the client should therefore be advised to move slowly when rising from a sitting or lying position. Answer A is incorrect because increasing the number of pills the client takes can increase the side effects and is therefore not recommended. Answer C is incorrect because the medication should be taken at bedtime with no regard to food. Answer D is also incorrect because bradycardia is another effect of the medication. 78. The client has a cocaine addiction. The nurse should expect the client to be placed on which medication? A. Bromocriptine, Parlodel. B. Disulfiram, Antabuse. C. Methadone. D. THC. Answer A is correct. Bromocriptine, Parlodel, is classified as an anti-Parkinsonism drug and gives clients with this addiction a substitute for the neurotransmitter dopamine. It is therefore the medication utilized for addiction to cocaine. Answer B is incorrect because Antabuse is used for alcohol abuse. Answer C is incorrect as methadone is used for opioid addiction. Answer D is also incorrect as THC is marijuana and is not utilized for replacement therapy. 79. A client has been placed on the drug valproic acid, Depakine. Which of the following symptoms would indicate to the nurse that the client is experiencing an adverse reaction to the drug? A. Lethargy. B. Photophobia. C. Poor skin turgor. D. Reported visual disturbances. Answer A is correct. This is because lethargy could be an indication of hepatotoxicity. The nurse should carefully monitor for any signs of anorexia, nausea, jaundice, facial edema, vomiting, and unusual bleeding or bruising. Answers B, C, and D are incorrect, as they are not clinical manifestations of adverse effects of the drug Depakine. 80. A client with a diagnosis of amyotrophic lateral sclerosis, ALS, has received a prescription for riluzole, Rilutech. Which instructions should the nurse include when teaching the client about this medication? Select all that apply. A. Avoid any use of alcohol. B. Laboratory tests will be monitored regularly. C. Medication should be taken at the same time every day. D. Report any fever to the healthcare provider. E. Take the medication with meals. Answers A, B, C, and D are all correct. A client placed on Rilutech should avoid using alcohol, report any signs of fever, and take the medication at the same time each day. These factors, along with the monitoring of laboratory values, are all information that should be included in the teaching plan. Answer E is incorrect because the medication should not be taken with food. 81. The nurse is caring for a client with leukemia who has been maintained with doxorubicin, adriamycin. Which toxic effects of this medication should the nurse immediately report to the physician? A. Elevated BUN and dry, flaky skin. B. Nausea and vomiting. C. Rales and distended neck veins. D. Red discoloration of the urine. Answer C is correct. The medication can cause cardiotoxicity, exhibited by changes in the ECG and congestive heart failure. Rales and distended neck veins are clinical manifestations of congestive heart failure and must be reported immediately. Answer A is incorrect, as this effect is not specific to the medication. Answer B is incorrect because nausea and vomiting is a common side effect, and therefore there is no need to report this immediately to the doctor. Answer D is incorrect because the reddish discoloration of the urine is a harmless side effect of the medication. 82. The nurse is performing an admission history for a client recovering from a stroke. The client's medication history reveals that the client has been taking clopidogrel, Plavix. Which clinical manifestation alerts the nurse to an adverse effect of this medication? A. Epistaxis. B. Hyperactivity. C. Hypothermia. D. Nausea. Answer A is correct. The medication Plavix is an antiplatelet, and therefore epistaxis, bleeding from the nose, could indicate a severe effect. Answers B, C, and D have no direct relation to the undesired effects of the medication. 83. A client with angina is experiencing migraines and has received a prescription for sumatriptan succinate, Imitrex. Which of the following nursing actions is most appropriate? A. Call the doctor to question the prescription order. B. Consult social services for financial assistance with obtaining the drug. C. Perform discharge teaching for this medication. D. Try to obtain samples for the client to take home. Answer A is correct. Answer A is most appropriate in this scenario. The medication results in cranial vasoconstriction to reduce pain, but can also cause vasoconstrictive effects. Because of this, it is contraindicated in clients who have angina. Therefore, it is necessary to contact and notify the doctor. Answer C is appropriate also, but answer A is more appropriate. Answers B and D are incorrect. These are both inappropriate actions. 84. A client with increased intracranial pressure is maintained on furosemide, Lasix, and osmetrol, mannitol. The nurse recognizes that these two medications are administered to reverse which effect? A. Cellular edema. B. Energy failure. C. Excessive glutamate release. D. Excessive intracellular calcium. Answer A is correct. The medications Lasix and mannitol are given for their diuretic effects in decreasing cerebral edema. Answers C, B, and D are therefore incorrect. 85. A client has an order for cisplatin, platinol. Which medication would the nurse expect to be ordered in order to reduce renal toxicity from the cisplatin infusion? A. Pamidronate, Aredia. B. Mesna, Mesnex. C. Dexrazoxane, Zinacard. D. Amifostine, Ethiol. Answer D is correct. The drug ethiol is used to reduce renal toxicity with cisplatin administration. Answers A, B, and C are therefore incorrect, as these drugs are cytoprotectants which are not utilized for cisplatin administration. 86. A client with a ruptured cerebral aneurysm has received an order for nimodipine, Nimotop. Which of the following is a desired effect of this drug? A. Restoration of a normal blood pressure reading. B. Prevention of the influx of calcium into cells. C. Prevention of the inflammatory process. D. Dissolving the clot that has formed. Answer B is correct. The medication Nimotop is a calcium channel blocker that is used to prevent calcium influx. The causation of vasospasm of the blood vessel is thought to be related to this calcium influx. Because of this, Nimotop is administered to prevent this. Answers A, C, and D are incorrect as they do not describe the action of this drug. 87. The client with erosive gastritis has been placed on Nexium, esomeprazole. The nurse should administer the drug A. With each meal. B. In a single dose at bedtime. C. 30 minutes before a meal. D. 30 minutes after meals. Answer C is correct. This is because Nexium is a proton pump inhibitor that should be taken before meals. Answers A, B, and D are incorrect administration times for proton pump inhibitors like Nexium. 88. The doctor has ordered ranitidine, Zantac, for a client with erosive gastritis. The nurse should give the medication A. 30 minutes before meals. B. With each meal. C. In a single dose at bedtime. D. 60 minutes after meals. Answer B is correct. This is because Zantac, ranitidine, is a histamine blocker that should be taken with meals for optimal effect. Note, however, that Tagamet, cimetidine, is a histamine blocker that can be given in one dose at bedtime. Answers A and D are incorrect, as neither of these drugs should be given before or after meals. 89. A client with gallstones and obstructive jaundice is experiencing severe itching. The doctor has ordered cholestyramine, Questran, and the client requested information as to how this medication works. Which of the following statements is the best response a nurse can give? A. It binds with bile acids and is secreted in bowel movements with stool. B. It blocks histamine, thereby reducing the allergic response. C. It decreases the amount of bile in the gallbladder. D. It inhibits the enzyme responsible for bile excretion. Answer A is correct. Questran works by binding the bile acid in the GI tract and eliminating it. This reduces the itching sensation associated with jaundice. Answers B, C, and D are incorrect, as they are not answers as to how the medication works to decrease itching. 90. The nurse is looking after a client who abuses narcotics. The client is exhibiting a respiratory rate of 10 and dilated pupils. Which medication should the nurse expect to administer? A. Chlordiazepoxide, Librium. B. Haloperidol, Haldol. C. Meperidine, Demerol. D. Naloxone, Narcan. Answer D is correct. The nurse should expect to administer Narcan. This is because the client is exhibiting signs of respiratory depression from the use of narcotics, and therefore requires an antagonist to reverse the effects. Answer A and B are incorrect, as these are anti-anxiety and antipsychotic medications, not narcotic reversal drugs. Answer C is incorrect because Demerol is a narcotic that would only increase the adverse effects that the client is experiencing. 91. The client with urinary tract infection is placed on furadintin. He may also receive ascorbic acid. The rationale to use this additional medication is to A. Promote tissue repair. B. Fortify mucosal repair. C. Alkalinize the urine. D. Acidify the urine. Answer D is correct. The antimicrobial activity of furadintin is more effective in an acid urine. Because of this, ascorbic acid or vitamin C is used to acidify the urine. Answers A, B, and C are incorrect. 92. The nurse is about to instruct a client about phenytoin sodium, Dilantin. Which information would be most important to teach the client as to why the drug should not be stopped abruptly? A. A hypoglycemic reaction can develop. B. Heart block can develop. C. Status epilepticus can develop. D. The client can develop a physical dependence over time. Answer C is correct. A sudden discontinuation of seizure medication can cause status epilepticus to occur. This disorder is life-threatening, and it is therefore crucial that the client is informed about this. Answers A, B, and D are incorrect, because these are not correct statements about the medication. 93. The physician orders dopamine for a client with left ventricular failure and a high pulmonary capillary wedge pressure, PCWP, to improve ventricular function. The nurse knows that the medication is having its intended effect when A. Blood pressure decreases. B. Blood pressure rises. C. Cardiac index falls. D. PCWP rises. Answer B is correct. The dopamine is having a desired effect when blood pressure rises. This is because it will cause vasoconstriction peripherally, but increase renal perfusion, and the blood pressure will rise. Answer A is incorrect, as it is the opposite of B. Answer C is also incorrect because the cardiac index will rise. Answer D is likewise incorrect because the PCWP should decrease. 94. The physician has prescribed a Becloforte, beclomethasone, inhaler, 2 puffs twice a day for a client with asthma. The nurse should instruct the client to report A. A sore throat, B. Changes in mood, C. Difficulty in sleeping, D. Increased weight. Answer A is correct. This is because clients on steroid medications, including beclomethasone, can develop adverse side effects, such as oral infections with Candida albicans. Both a sore throat and white patches on the oral mucosa are symptoms of Candida albicans and must therefore be reported immediately. Answers B, C, and D are incorrect because increased weight, difficulty sleeping, and changes in mood are all expected side effects of the medication. 95. The nurse visits a home client with hypertension who has been maintained on a daily dose of methyldopa, Aldamet. The client informs the nurse that they have been experiencing symptoms of lethargy and drowsiness. The appropriate nursing intervention would be to A. Ask the physician to order a different antihypertensive. B. Explain to the client that these are expected side effects. C. Report the negative side effects to the physician to have the dose reduced. D. Suggest that the client take the medication at bedtime and to reevaluate next time. Answer D is correct. These side effects may be present with this drug, but can be alleviated if the drug is taken in the evening. Taking one dose in the evening can often minimize the sedation. The nurse should nevertheless report the side effects to the physician and follow up with the client. Answers A, B, and C are incorrect. 96. The mother of a client contacts the clinic informing that nurse that her daughter cannot swallow the capsule because it is too large. The nurse finds that the medication is a capsule marked SR. The nurse should instruct the mother to A. Call the pharmacist and request an alternative preparation of the medication. B. Crush the medication and administer it with 8 ounces of liquid. C. Open the capsule and mix the medication with ice cream. D. Stop the medication and inform the physician at the follow-up visit. Answer A is correct. SR stands for sustained release, and these medications cannot be altered. The mother should therefore be instructed to request an alternative preparation of the medication from the pharmacist. Answers B and C are incorrect because crushing or opening the capsule is not allowed. Answer D is also incorrect, as it is not necessary to notify the doctor immediately. 97. The client with rheumatoid arthritis has been placed on aspirin, 20 grains 3 times daily, and prednisone, 10 milligrams twice daily, for 2 years. The most important assessment the nurse should make is whether the client has experienced A. Blurred vision, B. A decreased sense of appetite, C. Headaches, D. Tarry stools. Answer D is correct. This is because aspirin impedes clotting by blocking prostaglandin synthesis. This can lead to bleeding. A common side effect of the medication prednisone is gastric irritation, which can likewise lead to bleeding. Tarry stools indicate bleeding in the upper GI system, which should be immediately reported. Answers A, B, and D are incorrect. Although these should also be noted and reported, they are not the most important assessment for the nurse to make and are therefore incorrect. 98. A client scheduled for disc surgery informs the nurse that she frequently uses the herbal supplement kava kava, Piper methysticum. The nurse should immediately report this to the doctor because kava kava A. depresses the immune system, so infection is more of a problem. B. eliminates the need for antimicrobial therapy following the surgery. C. increases the effects of anesthesia and postoperative analgesia. D. increases urinary output, so a urinary catheter will be needed postoperatively. Answer C is correct. The herbal kava kava can increase the effects of anesthesia and postoperative analgesia. Answers A, B, and D are incorrect because they are not related to the use of kava kava. 99. The physician has ordered several medications, including beta blocker atenolol, for a client with congestive heart failure. The client requested information as to how this medication works. Which of the following statements is the best response a nurse can give? A. It causes vasodilation of coronary vessels. B. It increases the heart rate and forces contraction. C. It decreases the heart rate and forces contraction. D. It reduces myocardial oxygen demands. Answer C is correct. Beta blockers decrease the heart rate and force contraction, thereby reducing vasoconstriction by antagonizing beta receptors in the myocardium and vasculature. Answers A and D are incorrect, as they refer to the action of nitrates and calcium channel blockers, such as diltiazem. Answer B is also incorrect, because it is the opposite of answer C, and therefore untrue. 100. A client with a detached retina has just been admitted, and surgery has been scheduled. The nurse knows that the pre-op ophthalmic medication most likely to be ordered for the client will be A. atropine sulfate, B. carbamolcolin, C. pilocarpine, D. timolol maleate. Answer A is correct. This is because the medications used pre-op to widely dilate the pupil are mydriatic drugs. Both atropine sulfate and epinephrine HCl are commonly used. Answer B and C are incorrect because these are miotics used for certain types of lens implants and glaucoma. Answer D is also incorrect because timolol maleate is a beta blocker used for glaucoma. 101. A client is about to be discharged with an order for bishydroxycoumarin, dicumarol. Which instructions should be included in the teaching plan? A. The client should shave with an electric razor. B. The client should take the medication prior to eating. C. It is for the physician to teach the client about the medication. D. If the client misses a dose, he should take a double dose next time. Answer A is correct. The medication dicumarol is an anticoagulant drug, and because of this, one of the dangers is bleeding. Using a safety razor can lead to bleeding through cuts, and the client should therefore use an electric razor. Answer B is incorrect because although the drug should be taken at the same time every day, there is no relation to meals. Answer C is incorrect, and answer D is also incorrect because due to the danger of bleeding, missed doses should not be made up. Section 3. Pharmacology Study Checklist. 1. 3 areas of pharmacology. It's important to remember that pharmacology includes 3 areas. Pharmacokinetics, This is the study of how medications are absorbed, metabolized, distributed, and excreted by the body. Pharmacokinetics is particularly relevant when it comes to clients with renal or liver disease, or elderly clients who frequently encounter difficulties when it comes to metabolizing and excreting medications. Pharmacodynamics. This is the study of how medications are used by the body. Pharmacotherapeutics. This is the study of how the client responds to the drug. 2. Pharmacology in nursing practice. In nursing practice, nurses are expected to apply their knowledge of pharmacology in order to recognize common uses, side effects, and adverse effects of their client's medication, meet the learning needs of their client, challenge medication errors. Test takers need to remember the medication classifications commonly used in medical and surgical settings and their effects on the body. Antacids. Antacids reduce hydrochloric acid in the stomach. Constipation is a common side effect of calcium and aluminum-based antacids. Diarrhea is a common side effect of magnesium-based antacids. Anti-infectives. Anti-infectives are used to treat infections. A common side effect includes GI upset. Anti-anemics. Anti-anemics increase red blood cell production by increasing the amount of hemoglobin in the blood, or number of red blood cells. B12, iron, and epigen, erythropoietin, are all examples of anti-anemics. Anticholinergics. Anticholinergics are used to induce dryness in mucous membranes, which causes a decrease in oral secretions. Anticholinergics, such as atropine, are often administered prior to operations. Anticoagulants. Anticoagulants prevent the coagulation, i.e. clotting, of blood.